Hello, my name is Lindsay Solfelt, and I'll be walking you through a portion of my dissertation titled The Long-Term Follow-Up of the Hope-Focused Couple Approach. Big thank you to my dissertation committee of Dr. Ripley, who's actually one of the creators and founders of the Hope-Focused Couple Approach, as well as Dr. Ord. So looking at the problem, 90% of the population gets married by age 50 in Western cultures. However, an estimated 40 to 50% of married couples in the US get divorced, with subsequent marriages holding an even higher percentage. So that relational distress, dissatisfaction, and divorce may result in significant difficulties and problems for couples, families, and children. But the good news is that couple interventions can help. So couple therapy has been found to be an effective treatment for couples experiencing relational distress, with effect sizes similar to those found in individual therapy. But few studies have examined the long-term effectiveness of couple therapy, and there have been no published studies on the long-term outcomes of the hope-focused couple approach at this time. So moving on to methods, my first hypothesis is that HFCA retains most of its efficacy in treating relational satisfaction or functioning and relationship quality after a long-term follow-up. Second hypothesis is that relational commitment predicts maintenance of gains as measured by the longer the marriage and higher levels of baseline self-report commitment. Finally, there will be a correlational exploration of gender, income, education level, infidelity, age, baseline RDAS, and baseline marital status, with no directional hypothesis at this time. The participants that were utilized were couples who participated in the HFCA treatment from 2006 to 2016, all at Hampton Roads. They were married, engaged, or cohabitating at the time. There were a few reasons certain couples were excluded from the study, which you can check out there. And additional demographic information is included on the poster itself. The therapists were students in the Regent doctoral program who were under supervision, and the measurements utilized were the Revised Dyadic Adjustment Scale, or RDAS, and the Clinical Couples Assessment of Relationship Elements, or the CARE. So looking at results, we did find that participants improved according to the RDAS, looking at baseline at time 1 on this graph, an increase at time 2 is post-treatment, a little decrease at 6-month follow-up, time 3, but then going back up to those gains at time 4, which is that 2 to 10 year follow-up time period. So currently, according to the literature, we knew this hockey stick pattern of going up and then down 6-month follow-up, but that time from 3 to 4, that 2 to 10 year follow-up time period, we didn't quite have that information on couples rebounding, going back to the gains that they did maintain or that they did make through couples therapy. So really exciting to see not just that they go down after about 6 months, but that they're able to work their way up, back up. So thinking about there are short and long-term gains demonstrated by the hope-focused couples approach, which is great. And this is one of 3 recent clinical studies to evidence efficacy of the hope-focused couple approach. So although there hasn't been publications yet, there is work to show that HFCA is working, couples are making gains, and then they're maintaining those over a long period of time, even if there is a little dip in between there. However, limitations do include there was not a control group that varied sampling between that 2 to 10 year mark of follow-up, but according to statistics so far, the time of follow-up between that 2 to 10 years was not significant, thankfully, as well as measurement limitations from the RDAS or the CARE itself. Currently looking at the RDAS. So thank you for paying attention so far, and if you have any questions, please feel free to reach out. A reference list is linked in the presentation in the poster as well.